Thank you so much. It's actually augmented reality in TKR, not augment because it got printed out a bit with some kind of error. Uh, what I'm going to speak upon is what they say is going to be a kind of disruptive technology which is going to come out in joint replacement surgeries in coming couple of years. Uh, so what is augmented reality? As we all know about virtual reality. Virtual reality as in we wear the glasses and we see kind of games and everything. Augmented reality is in a sense is a technology where you allow the digital images and information to be displayed on the physical environment. Suppose I wish to walk from here to there. And if you know, if somebody can implant some description or data in front of you that say that is 10 meters, so that is what is augmented reality. Just giving you an example, if anybody can correlate, what is this? This is actually Tesla's autopilot. So you can see the roads in black and white and how the data it's capturing. We know that Tesla autopilot in US can drive around by itself. So it's calculating each and everything. And this is what is augmented reality in total joint replacements. It's basically when you are doing the surgery, you are seeing each and everything on the field. You're getting all your mechanical axes, angles, and everything projected directly in front of you while you're operating. How? By the use of smart glasses and certain tech sensors. So digital orthopedics, we know about how it has evolved over a period from conventional TKRs to orthopedic navigations to robotic surgeries. And now we are into a phase where we are getting into virtual surgeries by means of augmented reality or mixed realities. So not a new concept. The study was going on experimentally since 2020. And disruptive is not my word. It is actually what has been published in papers that it's going to change the scenario of joint replacements world over very shortly. So what is happening in this tech is just like you have used a conventional navigation, makes use of wearable glasses. That's the difference. Instead of cameras, you are making use of wearable glasses. You are putting in reusable ceramic sensors in a pinless mode, as you use in Stryker Express system, if those who would have used Stryker's Express system. So you place in your markers, but when you are doing your surgery, you need not toggle your head between the screen and your surgical field and all that. You get each and everything projected as you are doing the surgery itself, as if somebody is telling you what's the angle and all that. So you get exactly the similar, it's a kind of animation what they have given out to me, but this is what you actually get on the field, whatever you're doing. So that is what is augmented reality. So why do we need all this? We already are discussing robotics, we already are discussing all this navigation and everything, so why do we need this thing? As you would have seen in live surgeries, the size of Mako or Cuvis, how big is it? Can you carry out here or there? So this thing has a very small footprint. It fits in this kind of a box. And those of us who operate at multiple places, you can take them, you can carry them along, and you can operate at one or two places as you wish. So it has a very smaller footprint. It's an open system. It's an open system. You wish to use any implant, you can put it. You need not be fixed, as we know that most of the implants are fixed with a particular proprietary software or something like that. So it's an open system. The cost. Yes, we have discussed about accuracies and everything. Yes, that's a very good thing. Robotics and aviation, everything is very good. But the cost factor. This system is supposed to be available in India in a couple of months at a much cheaper rate, at a fraction of a price of what systems which we have in the market at present. And not only in India, internationally as well. So we were lucky enough to have a couple of cases done at our place. One of the companies which does this is Pixie. It's from France. Wisconsin is a place where it was conceptualized, and we had a person, their clinical technical application specialist, his name is Jerome. He came to my place, he gave me all the technical things which we needed to do for the surgery. We did a couple of cases, so you can see that I am wearing the smart glasses and I am getting each and everything. For the sake of those people who are assisting you in the OT, you can have it directly beamed on a television as well. So these are the markers which we had placed. So open system, I was using something else, somebody else's tech, but I was able to do lots of things myself. And you can see the head gestures. I'm just tilting my head, and it is ready to take all data. So you do not need multiple personnels in your OT. So you can do lots of registrations, lots of things just by gestures of your head, control of your arm, and the control of your eyes. So as you can see that I'm taking the mechanical access, I'm able to see in the field, I'm doing the hip registrations and all that. So we had a good experience. Not a lot, we did 2 to 3 cases, and everything was available straightforward. Didn't have to do a lot of investment into equipments and all that, and the footprint was very small. So, learning curve, those who have used navigation or are already into robotics, it's very easy for them. What's the future for it? It's into commercialization, going to be available in India very shortly. I think they'll be announcing the launch in IOCON in Chandigarh this year. So they are also extrapolating it to robotic guidance. What they say is the robotics are still guided by haptic tech, which is 20 years behind. So by making use of this tech, they can decrease the size of that arm. It can be much more, it can be 80% thinner and leaner, and as compared to what we get right now. It can also be extrapolated to spine. We know that neuronavigation is a thing for putting pedicle screws and all that. So spine and trauma. So AR in joint replacements, AR in robotic joint replacements, AR in spine, as well as trauma. And they're also using it in other fields for training, especially using it in laparoscopies as well. And papers are already coming in. They have done, their designer surgeon, they have done around more than 100 cases in France. They're also doing cases in US right now. It's been FDA approved in 2021. And the results so far are good. They are saying that the accuracy is as less as 0.5 degree as compared to any other robotic or navigated system which is available in the market. So we were lucky enough to have them at our center in Gaya, which is a remote place compared to the cities, metro cities, and we had a chance to do 3 cases. And I have not gained a lot of experience out of it, but yes, I'm very hopeful that it comes out very well in coming years, especially for those surgeons who are at peripheral places and who are especially mobile, and the cost factor, which is not going to put a lot of blot on the patient's or impact on patients' finances as far as if you want to imbibe computer-assisted surgeries in for them. Thank you.
We are waiting for the